All of us develop our own routines for bathing and caring for our bodies early in life. We take these personal care routines for granted unless they are disrupted by illness or disability. Receiving care from another person may bring up a variety of feelings. When a husband provides care to his wife, or a daughter provides personal care to her father, feelings of shame, embarrassment, anger, or depression may occur. Even when the person providing care is a hired caregiver, the experience of physical exposure can trigger difficult emotions. Hello, I'm Marian Karpinski, and I'll be your host during this program. We will examine why personal care is important and how you can provide it safely and considerately. Caring for someone at home requires flexibility and problem solving. It isn't necessary to imitate a hospital setting. With a few simple home modifications, you can make caregiving easier and safer. For instance, the bedroom is not always the best place for an extended illness or recuperation. The person being cared for may feel isolated and miss the day-to-day activities of the household.
Some people like to have a lot of activity around. Some people like the teenagers and the grandkids running around if you're caring for an elderly person or a grandparent. So again, you just have to talk to the family and the setting and say what is going to work best for you. Different considerations when you're in a living area or a living room area is that there's more light, there's more things to look at. Some individuals like to see their birds outside the living room window. Some like to have the availability of their animals running in and out and the accessibility of the social environment that brings to them by having it in a more open space.
Some things to think about when changing the location of care are whether windows or doors are drafty or too sunny, and if there are adequate electric outlets and room for necessary supplies. If the bathroom is too far to walk, a bedside commode may be more convenient. An electric or mechanical bed with adjustable heights and positions helps to make the work easier on your back. Social activity is important for everyone. If the person visited with a friend each week, try to arrange for the visits to continue.
Think for a minute about this person's world. You are coming into that person's world. That's all they have. Their world is confined to that small room. How can you make that world brighter for them, more exciting, entertaining? Can you bring music to that person's world? Can you bring lightness by opening curtains? Can you bring visitors in? Can you invite people in that haven't been in for a while? How do you embellish and bring a different quality to that person's world because they don't have the ability to do that anymore?
For your own safety, it is important to move your body correctly when lifting or moving people or objects. Before you lift, create a solid base with your feet apart and flat on the floor. Use the strong muscles of your thighs rather than your back when lifting. Keep the object close to your body. Don't twist, but pivot by turning your feet. Whenever you can, slide, roll, or push the object instead of lifting. The goal of infection control is to limit the spread of germs that can cause illness. Direct contact is one way that germs are spread. Anytime you touch someone who is sick, or whenever you handle another person's body fluid such as sputum, urine, stool, or blood, you are in direct contact. Germs are also spread indirectly through contact with clothing, bed linens, dressings, or objects used by an infected person. Proper hand washing is the single most effective way to prevent the spread of germs. Always wash your hands thoroughly before and after giving care. Keep your nails short. Avoid wearing artificial nails that can harbor fungus and are a potential source of infection. To wash your hands properly, begin by running the water and adjusting it to a comfortable temperature. Apply soap and work up a good lather. Begin washing from above the wrists to the fingertips. Friction helps to mechanically remove germs from the hands. Produce friction by using rotating and rubbing motions. Be thorough, rubbing all surfaces, including your palms, between your fingers, your thumbs, and fingertips. Move rings up so you can wash the area underneath. Vigorously wash for at least 15 seconds. Use a nail brush or orange stick to clean beneath your fingernails. Rinse thoroughly by holding your hands downward and rinse above the wrist to the fingertips. Use clean paper towels for drying and another to turn off the faucet. If water is not available or if time is a factor, the use of an alcohol-based hand rub is recommended. Apply the solution to the palm of one hand and rub all surfaces of both hands until your hands are dry. Gloves are used as a protective barrier against germs. Wear gloves when handling any body fluid and when touching surfaces or equipment that may have been contaminated with body fluid. To remove gloves, begin by placing the fingers of your right hand under the left wrist cuff on the outside of the glove. Pull the glove downward until it is off. The left glove is now inside out and held in your right hand. To remove the right hand glove, place your thumb or fingers into the inside cuff of the right glove. Pull the right glove down inside out. The right glove now contains the left glove inside it. Dispose of the gloves in a lined trash container. Wearing gloves does not eliminate the need for hand washing. Fluids can leak in at the cuff, a glove can have a hole in it, or it could be punctured during use. Always wash your hands before and after wearing gloves. Another important factor when providing personal care is respect for the individual's privacy. A closed door or room screen, a lowered window shade, use of a towel or light blanket for covering are simple measures that help to protect a person's privacy. Privacy also includes protecting the details of a person's life and condition. Discuss essential information only with those who need to know in order to provide care. Protecting privacy shows respect for that person's human dignity. Another way to show respect is to honor the individual's preferences.
The best way to address what's important to the person you're giving care to is to ask them. Honor what their preferences are by asking them, how would you like this done? Would you like music played? Would you like this to be turned lower? Would you like me to open the door as I leave or leave it closed? How would you like things to be? In and around their environment, when a person is bed confined or confined to a room, they've lost a lot of choices. And so we need to bring back choices to them. And what I like to tell caregivers is don't make assumptions. Don't think that what you like is what they're going to like. So give them a lot of room for choices that will honor them.
The third aspect of personal care is to promote independence. It may be easier, more efficient, or seem more loving to do things for the other person, but it is better psychologically and physically for the individual to do as much self-care as possible. You may need to deliberately slow your pace in order to create opportunities for self-care. Oral hygiene is cleaning the teeth, gums, and tongue. Oral hygiene helps to prevent tooth decay, gum disease, and mouth odor. Mouth care is recommended in the morning, after meals, and at night. Whenever you begin to provide personal care to someone, always tell the person what you plan to do. To avoid the danger of choking, make sure the person is as upright as possible. Place a towel on the person's chest under the chin. Give him a sip of water to moisten the mouth. Apply toothpaste and wet the toothbrush with water. Carefully brush the top, back, and front sections of each tooth. Gently brush the tongue as well. When you are finished, have him rinse his mouth with water. Flossing helps to remove food particles between the teeth. A flossing device allows you to floss another person's teeth safely. Before providing denture care, wash your hands and apply gloves. Then place a towel across the chest and under the chin. If the person needs assistance to remove the dentures, grasp the upper denture between your thumb and index finger. Use a gentle up and down motion until the suction releases, then pull downward to remove the denture. The lower denture is grasped the same way, using a slight twisting motion to release the suction before lifting it out of the mouth. Always place them directly into the denture cup. Place a paper or cloth towel in the sink to prevent breakage. Dentures can shatter if they are dropped even a short distance. Rinse the dentures under cool water. Hot water can cause warping. With the dentures in the palm of your hand, apply toothpaste or denture paste and brush until all surfaces are clean. Then rinse thoroughly in cool water. Before replacing the dentures, clean the gums and tongue by using a soft brush or toothette. A toothette is a swab with a soft sponge on its tip. Look for any redness or sores that may be hidden by the dentures. After cleaning, rinse them out thoroughly. If a fixative product is used, follow the directions for its application. Moisten the dentures before replacing them. Grasp the front of the upper plate with your thumb and index finger. Raise the upper lip and slide the denture in, pressing it firmly upward into place. Repeat the process for the lower plate, pressing downward for a secure fit. Soak the dentures in a cleaning solution overnight. Follow the directions on the cleaning product's label. Dry mouth can result from certain medications or from mouth breathing. Sugarless hard candy, frequent sips of water, ice chips, and a moistened toothette are ways to relieve dryness. Bathing cleanses the skin by removing bacteria and decreasing body odor. Bathing stimulates circulation and helps to prevent skin breakdown.
Bathing is more than a task. It's an opportunity to actually work through a relationship with the person that you're caring for, if it's a family member or if it's a patient that you're providing a service for. And it really requires that you get to know the individual, both their likes and their dislikes, their rituals, if they have had rituals around bathing that make it much more enjoyable for them, so that it's something that they look forward to and it's not just something that's done to them and they don't have any controls over.
A complete bed bath is usually given 2 to 3 times per week. Check with the doctor or nurse about how often to give a complete bath. Frequent bathing may not be advisable for some people. A partial bath, including face and hands, underarms, back, and the genital area, is often sufficient between complete baths. The genital area should be cleaned each time there is bowel or bladder incontinence or other discharge. The most comfortable water temperature for bathing is 105 degrees. Use a thermometer to check water temperature in order to avoid accidental chilling or scalding. If you plan to use body lotion, you can warm it by placing the bottle in the warm bath water. If you do not have a thermometer, check the water on your inner wrist to determine if the temperature is comfortable. Always ask the person whether deodorant and lotions are acceptable before applying them. People who are ill are more sensitive to fragrances. It is best to use only fragrance-free products. Check to be sure the room is warm and free from drafts. Before you begin the bath, gather all the supplies at the bedside. Then wash your hands and apply gloves. Raise the bed to a comfortable working height. Have the person lie close to the side of the bed that you will be working from. Remove the top bed covers. Use a light blanket or a large bath towel to cover the person's body. Then remove the top sheet. Work under the bath blanket as you remove the clothing. During the bath, use one basin for washing and another for rinsing. If you are using a no-rinse soap, you can eliminate the rinse basin. Just add a small amount of no-rinse soap to the water. In this demonstration, we will be using a mild non-deodorant soap and 2 basins. Change the water frequently, especially when it becomes too dirty, soapy, or cool. Use one cloth to wash and a different one to rinse. Use a new cloth if it becomes dirty. Wet and wring out the washcloth so that it is wet but not dripping. Form a mitt by wrapping it around your hand in thirds. Then fold the excess length down over your palm and tuck the end in. Another method is to fold the washcloth into a triangle. With the pointed end toward your wrist, wrap one end across the back of your fingers and secure it with your little finger. Then wrap the other end around the back of your fingers and secure it with your thumb. Always begin with the cleanest body areas and end with the most soiled. Tell the person what you plan to do as you move from one part of the body to another. Begin to wipe the eyes from inner to outer corner using clean water only. Use a different part of the face cloth for the second eye. Wash the face with clear water or a cleansing lotion, moving from the center out to the ears and neck. Rinse the face if using a cleansing lotion. Then pat the skin dry. To wash the neck and behind the ears, apply a small amount of soap to the mitt and gently wash the area. Rinse and pat dry. Place a towel beneath the arm and hand to keep the bed dry. Even if the bed linens are changed after the bath, wet sheets may cause the person to chill. Support the arm at the elbow and wash from wrist to shoulder, a technique that promotes good circulation. Rinse and pat dry. Then wash the underarm area. Rinse and pat dry. To wash the hand, place it in a small basin of water and let it soak for a minute. Then wash the hand well, including areas between the fingers. After the hand is washed and dried, massage the hand with a small amount of lotion. Massage by using smooth, light strokes from the hand to the upper arm. For people with very thin, dry, fragile skin, avoid rubbing. It is best to pat the lotion on. To wash the chest, place a towel over the chest and pull the top covering down to the abdomen. Working under the towel, wash the chest. Carefully wash under the breasts. Moisture in that area can cause irritation and redness. Then rinse and dry the chest and breast area, including under the breast. Wash, rinse, and dry the abdomen. Pay particular attention to folds and creases where moisture and irritation may occur. Then replace the bath blanket over the upper body. Uncover the leg and place a towel underneath the leg to protect the bed. Bend the knee and support the leg beneath the knee as you wash from the ankle to upper thigh. Then rinse and pat the leg dry. Soak the foot in the basin before washing. Support the foot as you wash the foot and between the toes. Then dry well. Apply lotion to the top and bottom of the foot and heel, and gently massage. Avoid lotion between the toes. Apply lotion to the leg by patting it on. Never massage the legs. People who are confined to bed have an increased risk of blood clots. Massaging the legs could cause a blood clot to dislodge. After washing the legs and feet, change the water in the basin before continuing with the bath. To wash the back, turn the person to her side away from you and spread a towel lengthwise along the back. Starting at the neck, use long strokes to wash the back and buttocks. Look for any skin changes such as flaking or dryness. Notice any rashes, redness, scratches, swelling, or any signs of irritation, particularly over bony areas. Report any skin changes to the doctor or nurse immediately. Then rinse the back and buttocks. When finished, pat the area dry. After washing the back, apply lotion to your hands. Then rub the back with both hands beginning at the lower back. Using long, soothing strokes, move up toward the shoulders. Then massage using a circular motion from the shoulders down to the lower back. Continue this pattern for 3 to 5 minutes, applying more lotion as needed. Never massage reddened or irritated areas. These could indicate a pressure ulcer. At the end of the back rub, wipe away any excess lotion. Turning the person every 2 hours and bathing can help prevent pressure ulcers. With the person still lying on her side, move the towel to the buttocks and thigh area. Then turn her onto her back so that the towel is under the buttocks. Washing another person's genital and rectal area can produce anxiety and discomfort for the caregiver and the person receiving care. Being sensitive and respectful to the person's feelings can help reduce anxiety. Always encourage the person to do as much personal hygiene as possible. Some people will attempt to wash the genital area themselves, even though they are physically unable to do so. It is important to observe the person doing personal hygiene initially and from time to time to be sure that he or she is doing a good job. Begin with her knees bent and her legs slightly apart.
Okay. And I'm going to give you a washcloth. I want you to use different sections of the washcloth with each wipe. Here you are. Now let me help you. Good. Okay.
If she is unable to wash herself and you must clean the genital area, begin by telling the person what you plan to do. Use a slightly soapy washcloth or disposable wipe and gently wash from the front downwards toward the rectum. Avoid scrubbing motions.
When you're washing the bottom, you're going to use different sides of your washcloth, changing it with each wipe. Or you can use a disposable towelette and using one towelette per wipe. After completely washing and rinsing the genital area, you want to use a dry, clean towel and gently pat the area dry.
To wash a male's genitals, hold the penis with one hand and wash from the tip toward the base using a circular motion. For males who are uncircumcised, retract the foreskin to clean the head of the penis. With the man's legs slightly spread, gently wash and rinse the scrotum. Then pat it dry. To wash the rectal area, start with the person lying on his or her side with the knees bent. Lift the upper buttock with one hand to expose the anal opening. With the other hand, gently wash the area with a soapy washcloth, washing from the genital area to the rectum. Then rinse with a fresh, clean cloth and gently pat the area dry. After giving a bath, always dress the person in fresh clothing. To groom the hair, begin by placing a towel on the pillow. Some women with permed hair prefer to have their hair picked rather than brushed. Have her turn away from you so that you can work at the back of the head. If the hair is curly or tangled, begin at the ends of the hair and work in sections toward the scalp. To avoid pulling the hair, use one hand to hold the hair as you comb out the tangles. For some women, wearing makeup increases her sense of well-being. If she is unable to do it herself, offer to apply it for her. Bed linens should be changed after a complete bed bath or when soiled. The clothing, towels, and bed linens of a person with an infection or who is incontinent should be washed separately from the routine household laundry. Wash soiled laundry in hot water with a cup of chlorine bleach or Lysol added to the wash water. The best bed linens to use are made of natural fibers that are soft, lightweight, and washable. When you make the bed, keep in mind that the top covers can be heavy on a person's body. For some people, that weight is painful. Bed cradles help to keep the covers off the lower body. Another way to keep the covers off the lower body is to place a pillow against the bottom of the feet with the pillow sitting higher than the toes. Then the covers rest on the pillow rather than on the lower body. The top cover should never be tight across the feet. Tight covers can cause a shortening of the calf muscles, a condition that makes it difficult and painful for the person to stand. A night splint can help keep the calf muscles from tightening. To help prevent pressure ulcers on the heels of the feet, it is best to float the heels by placing a pillow from the knee to the ankle with the heels suspended off the bed. Heel protectors are also available. Whenever you leave the room after providing personal care, always be sure the person is warm, safe, comfortable, and has a way to call for help.
A device that's commonly used in home care environments is a baby monitor. A device is plugged in at the bedside. The person could speak as low as a whisper, and the person can pick up way in the back room that that individual needs help. You can hear, if a person's unable to communicate with words, you could hear coughs. You could hear someone gasping. You could hear any number of sounds with a baby monitor. So it's a very good device to use. communicating one room to the other, so you don't need to stay right in that room with the individual. A bell, just a little school bell, would be another way. There's a wide range of supplies available to help you in providing care in the home. A good thing to do is take a trip to the corner drugstore and look at what supplies are available. Many of the supplies are in and around the disposable product lines, disposable gloves, disposable incontinent pads that are simply a plastic-lined pad. They come in various different sizes, and you can use them under the bed, under the sheets. Before you, well, as you're making the bed, you would put one of them down to protect the mattress. Then you would make the bed, and you can put another one down between the individual and the bed. So if they soil that one spot, you don't have to completely change the whole linen. You can do a change of just that incontinent pad, and you don't have to change the whole bed. It saves you a lot of time and a lot of laundering.
Most people feel better when they change into daytime clothing rather than staying in pajamas. Getting dressed increases self-esteem and sets a rhythm for the day. Encourage the person to choose what he or she would like to wear. When assisting someone to dress and undress, be sensitive to modesty issues and try not to expose the body more than necessary. Larger size clothing, Velcro closures, elastic waistbands, zipper pulls, and big buttons can help make dressing and undressing easier. If someone has an injured, paralyzed, or weak arm or leg, always dress the injured arm or leg first and undress it last. The garment is most flexible at those times. To dress the upper body in a pullover top, insert your hand in the lower end of the sleeve, and as you hold his arm, slide the garment up the arm. Then pull the garment over the head. Guide the other arm into the sleeve.
When a person's in bed, it's actually pretty hard to change gowns. I think of a bed gown, a pajama, and it's really unnecessary to think that we have to get that pajama on as we normally did. Something that we do that's quite easy is to split the gown down the back. That way you just need to slip the arms through, and you're not having to get it over their neck and around the back. It prevents injury to the shoulders. It prevents wrinkles from being around the backside that are hard to get out. It just makes everything easier.
To dress the lower body of someone who is in bed, place both feet in the pant legs. Then ask the person to lift his hips away from the bed as you draw the pants up. If the person is unable to lift the hips, roll him on his side and pull the garment up. To put on socks, gather the sock and draw it over the toes and heel. Check heel placement and make sure that the toes have room to move around. Then smooth any wrinkles. To help dress someone who can sit or stand, begin by having the person sit at the edge of the bed. To dress the lower body, place one foot at a time into the pant legs. Then draw the pants up over the feet and ankles. Help the person to stand and pull the garment up to the waist. For a shirt or blouse that opens in front, place your hand in the lower end of the sleeve and gather the sleeve up to the armhole. Holding the person's hand, guide the sleeve of the garment up over the person's arm to the shoulder. Then bring the garment across the back and with the second arm bent towards the head, guide it through the other sleeve, being careful not to pull on the arm. Clean and trimmed nails help prevent infection, odor, and skin injury. At least once a week, check the fingers and toes for ingrown nails, redness, cracking, swelling, or infection. Report any changes to the doctor or nurse. Never trim the nails of a person who has diabetes, circulation problems, or who has very thick nails. Check with the doctor, podiatrist, or foot clinic to find out if you can do nail care at home under these conditions, or if it must be done by a professional. Never cut corns or bunions. Always wash your hands and wear gloves when providing nail care. Fingernails are easier to clean and cut after the fingers soak for 5 minutes in warm water. Soak the hands one at a time. When you remove the first hand from the water, soak the second hand. Clean under the nails using an orange stick or a nail brush. Never use sharp objects to clean under the nails. Then gently push the cuticles back using the broad end of an orange stick. Then dry the hand well. To cut the fingernails, clip them straight across. Round and smooth the edges of the nails with an emery board. Then gently massage the hand with lotion. To clean and trim the toenails, first check the water temperature on your inner wrist to make sure it is not too hot. Then soak the feet for at least 10 minutes in warm water. Use an orange stick to clean under the nails. Gently push the cuticles using an orange stick. Dry the foot thoroughly, especially between the toes. Clip the toenails straight across, being careful not to cut or damage the skin around the nail. Smooth the edges of the nail with an emery board, but do not round the edges. Apply lotion if desired to the top and bottom of the foot, but avoid getting lotion between the toes where moisture can encourage fungal growth. When finished, gather and clean supplies. Then remove gloves and wash your hands. Shaving is a daily routine for most men. Never shave a person with a straight edge razor. Use a disposable razor, a razor with a disposable blade, or an electric razor instead. Never use an electric shaver if oxygen is in use, as sparks from the razor could cause a fire. If the person is on blood thinners, check with the doctor or nurse for any special shaving instructions. Help the person sit as upright as possible. If dentures are worn, be sure they are in place before shaving. Place a towel across the chest beneath the chin. To soften the beard, place a warm washcloth on the face for 2 to 3 minutes. Then apply the shaving cream and lather. Hold the skin taut by pressing and pulling the skin up toward the ear. Shave over the cheeks using gentle pressure and short, even strokes, moving the blade down in the direction that the hair grows. Rinse the blade as needed. To shave the upper lip, have the person press both lips together to make the upper lip taut. Then shave from the nose to the upper lip in short strokes. Shave the chin by keeping the skin taut and use short, even strokes. Shave the neck by bringing the razor up toward the chin. Rinse the blade in warm water as needed and change the water if necessary. If the skin gets nicked during shaving, apply a piece of tissue with a slight pressure to stop the bleeding. Use a warm face cloth for the final rinse and pat the skin dry with a towel. An electric razor is used on clean skin only. No additional water or shaving lather is needed. Shampooing increases circulation, cleans the hair and scalp, and brings a sense of freshness and renewal. Dry and no-rinse shampoos are available and eliminate the need for water. Simply follow the directions on the label. For most people, washing the hair with water is more enjoyable. Position the person on the side of the bed you will be working from, then place a waterproof sheet beneath the head and shoulders. Place a bath blanket over the plastic. Then position the shampoo tray under the head, with the end of the drain hose in a bucket or large wastebasket. Be sure that the shoulder area is covered so that the person remains warm. Remove any hearing aids or eyeglasses and place them in a safe and dry place. Place a dry face cloth over the eyes to protect them from water and shampoo. Test the water temperature on your wrist. It should be about 100 degrees Fahrenheit. Using a pitcher, pour water over the hair. When the hair is wet, apply a small amount of shampoo. Lather well from front to back by rubbing with the pads of your fingers. Massage the scalp for a few minutes to increase circulation. When you are finished, rinse the hair well. Support the head as you remove the shampoo tray. Then wrap the hair in a towel. Use the towel to dry the hair as much as possible. When combing wet hair, be especially careful because it is more elastic and fragile than dry hair. A large tooth comb works best. If you use an electric hair dryer, choose the coolest setting to avoid burns. Never use an electric dryer when oxygen is in use because of the potential for fire. Always check with the person how he or she would like you to dry and finish the hair. When you are finished, remove the bath towel and plastic covering. Reposition the person to the center of the bed. Leave the shampoo tray inflated until it is dry. Remove gloves and wash your hands. The procedures we have shown you for providing personal care are widely used and accepted, but sometimes a procedure must be adjusted to fit a particular situation. That's okay as long as you apply the principles behind it, such as working from clean to dirty, or infection control and hand washing, or the principles of body mechanics when moving or lifting. Personal care is important to our health and well-being. When we provide care in a gentle, thorough way, we help the person to feel better, and we honor that person's dignity.